Hello everyone, this is Dr. Mohammad Asad and I am doing my fellowship in Radiation Oncology, and I have started this series of discussing trials. With help of these trials I will discuss biostats. So let's begin with Prodige-23 trial. This was randomized multicentric open label phase 3 trial, and 461 patients were enrolled, and treatment arm had 231 patients and standard arm had 230 patients. This was inclusion criteria of this trial, and primary endpoints and secondary endpoints. So let's discuss these terms. As this trial was randomized control trial, so there was randomization done and between these two arms, and there was a control arm. So that's why this trial is known as randomized control trial. The other term was open label. When a trial is open label, it means that there was no blinding done. And we all know that blinding is of two types: single blinding and double blinding. When a trial is single blind, it means only investigator and assessor are blind while the patient are not blind. When a trial is double blind, it means both the patient as well as the investigator and assessor are blind. And an ideal trial is that which is double blind and randomized as well as placebo controlled. So the third term was phase 3 trial. So regarding phases of trial are of 4 phases: phase 1, phase 2, phase 3 and phase 4. Phase 1 is the very first phase of testing any drug, any therapy in humans. It is done to check the safety of drug, and it will also identify maximum tolerance dose as well as dose limiting toxicity. I will discuss these two terms in upcoming videos. So let's now talk about phase 2. Phase 2 trials check about drug, that does it works or not. It will screen out ineffective drugs as well as identify promising drugs. Regarding phase 3 trial, it will check that the drug is better than the standard or not, and it will also test the efficacy of drug definitely. Regarding phase 4 trials, phase 4 trials are conducted after a drug is licensed, and they will gather additional information about efficacy as well as long-term toxicity of the drug. So regarding the other points that were mentioned, uh, primary endpoint as well as secondary endpoints. What is meant by primary endpoint? Primary endpoint is defined as the outcome that is most accurately reflecting the benefit of the new therapy. So regarding Prodige, they used DFS, disease-free survival, as primary endpoint. OS cannot be used as primary endpoint as it requires long-term follow-up. So most trials use DFS as primary, or the outcome that is more beneficial for the therapy. So DFS is defined as the time interval from randomization to the first cancer-related event, any second cancer, or death from any cause. That is defined as DFS. I will discuss about the results of that trial with these headings after this slide. Regarding secondary endpoints, multiple secondary endpoints can be taken out from a trial by subgroup analysis. So secondary endpoints are often related to the toxicity: OS, MFS, PCR, DR, TF, disease related treatment failure. What is meant by overall survival? It is time from randomization to death from any cause, that is defined as OS. Regarding metastasis free survival, it is time from randomization to the occurrence of first event, that is distant metastasis. Regarding the results of Prodige-23 trial, they didn't use hazard ratio, but they used restricted mean survival time. That is, in simple terms, means that average time when patients were free of cancer in fixed window of time. In a very simpler way, it means how many more months the patients will stay disease free. That was restricted mean survival time. Let's discuss the results of Prodige-23 trial. Regarding PCR, in ESCO 2020, it showed 28% versus 12% with the p-value of less than 0.001 value. And regarding the 7-year DFS, it was 68% in treatment arm and 63% in standard arm. And restricted mean survival time of 5.7 months. And 7-year metastasis free survival was 79% versus 72% with 6.1 months of restricted mean survival time. And regarding the 7-year OS, it was 82% versus 76%, and with the restricted mean survival time of 4.3 months. It means that the treatment arm had advantage of 4.3 months over the standard arm. Let's analyze this trial. This trial had equal distribution in both arms for DFS, and it had clear guidelines for adjuvant chemotherapy, and yes, up to 7 years of follow-up, and this trial showed OS benefit. Regarding limitation of this trial, it was open label, no blinding was done, and maybe clinical T3 node negative patient be overtreated, and same modified FOLFIRINOX was used in control arm as well as treatment arm instead of if we used compared with some other, and all patients underwent surgery. Even there was PCR of 28% and no wait and watch policy was used. So regarding conclusion of this Prodige-23 trial, it established modified FOLFIRINOX based total neoadjuvant therapy as superior standard for high-risk rectal cancer, providing the strongest evidence to date with a significant improvement in overall survival despite evolving treatment paradigms. Thank you so much, and if you have any question and if you find any mistake, do mention that in comments below. Thank you so much.